From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Health System turns 30 this year. You have probably heard talk about Bon Secours Health System turning 30 this year, and it was just last July the word started trickling out about the event. Back in July 2012, Father Joe Driscoll and his anniversary committee started pulling together some history and publishing a monthly newsletter called Bon Secours Health System at 30. And every month since then, they have published that newsletter without fail for all to see, with stories about the sisters, sponsors and members, past and present, and future leaders. The inaugural July edition started with the idea that stories are what make up our lives, and that the story of Bon Secours Health System starts with the story of the Sisters of Bon Secours. In the July edition, there is a story from Sisters of Bon Secours archivist Mary Herbert that provides a brief history of the sisters in the U.S. Father Joe also interviews Sister Mary Shimo about the sisters' archives and a listing of other significant events that have happened 30 years ago are also posted. All inspirational stories about the past to inspire the future. Every issue since then has had stories that inspire, stories that reflect on the past, stories of our sponsors, stories of our sisters, stories of our future, indeed, stories of our lives. The latest edition of BSN at 30 just came out, but you can see all of the newsletters on Iris. Just search for the term BSN at 30. Bon Secours Health System turns 30 this July 2013, and BSN is celebrating all year long with stories we can all appreciate. Watch for future editions and get yours on Iris. Bon Secours at 30, an inspiring past, empowering an inspiring future. In other news, Bon Secours' Strategic Quality Plan runs fiscal year 2013 through fiscal year 2015, and if you are not familiar with it, we hope to change that. Right now, we continue in our series of SQP goals with our next goal, transform our health delivery. But what does that mean, and more importantly, how do we do that? Here's CEO Rich DeTuto to help explain that goal and its sub-goals.
Transforming our healthcare delivery, one of the things that's really important for us is that we have a strong primary care base. Physicians, allied health professionals, nurse practitioners that integrate wellness. We develop medical homes that are not reactive to patient care when someone shows up at the office, but that we're proactive in terms of planning their care needs over a longer period of time. We want to be able to coordinate that, and one of the measurements we said is, if we're going to grow as a ministry, we want to make sure that our primary care share exceeds our current acute care share as an organization. And so we'll begin to measure that. In order to continue to invest in our ministry, in order for us to serve the vulnerable and the poor and be responsive, we need to generate, at a minimum, a 4% operating margin. So there's a lot of work that needs to go into what we're doing to make sure that we're efficient and effective. We need to work with all of our physicians and make sure that the care we're providing is optimal. We're not overutilizing testing and services. Our electronic medical record helps us. We have a huge database that we can mine and understand where is the best practices in terms of care for chronic diseases and other services that we provide. We need to make sure that we're not wasting any dollars, that we're contracting effectively across all of our communities, and that we're purchasing our services effectively. Long term, we really need to be in the top quartile around the country in terms of our cost per case. I think as an industry, we've not spent a lot of our time and focus to look at the cost and bending that cost curve. But if we're going to provide value to the purchasers, we need to be high quality, efficient, and do it for a lower cost than we're doing currently.
Bon Secours' strategic quality plan, keeping up with the changing healthcare environment, yet remaining true to our call to be good help to those in need. Finally, has Bon Secours Severe Nursing Care Center gone to the dogs? Well, that is not necessarily a bad thing. Bon Secours Severe Nursing Care Center has received a $58,400 two-year grant from Amy's Place Foundation to launch a first-of-a-kind, comprehensive inpatient pet therapeutic treatment program. Now, I know what you're thinking, and no, we don't have inpatient pets, but we do have inpatients with pets. Let me explain. The new program is called Come Mend with Your Friend and is an important initiative that will help many elders and their pets. So here's the scoop. Many times, elders who are admitted to the hospital in a crisis situation don't have time to plan for their pet's care. Sometimes it is up to the family or friends or neighbors, but many times there simply is no one there to take care of their pet. Enter the Come Mend with Your Friend program. Through the grant from Amy's Place Foundation, certified veterinary clinicians will care for the pets on a daily basis, and a consultant veterinarian will evaluate the health and safety of all new pet admissions. Then, the patients will be able to spend therapeutic quality time with their pets throughout the day during their recovery process. This type of therapeutic quality time has proven to be both physically and emotionally healing for the patient and their pets, not to mention the Bon Secours Severe Nursing Care Center staff. But depending on the patient's abilities, caring for their pet will also be included as part of their daily rehabilitation therapy program. So, Bon Secours Severe Nursing Care Center has gone to the dogs and other pets in a good way, and in the process providing an innovative way to provide good help to those in need. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.